Good afternoon, and welcome to a webinar on retail food safety and reopening action plans hosted by EAS Consulting Group and presented by EAS independent consultants Charles Otto and Lisa Berger. EAS, a member of the Certified Family of Companies, is a global leader in regulatory solutions for industries regulated by FDA, USDA, and federal and state agencies. Our network of over 150 independent advisors and consultants enables EAS to provide comprehensive consulting, training, and auditing services, ensuring proactive regulatory compliance. And we are very pleased to present numerous web-based trainings on a variety of regulatory topics, including numerous presentations in the COVID-19 era on FDA temporary enforcement policies, and all of those are found recorded versions of all of those are found on our website, easconsultinggroup.com, under Resources and On-Demand Webinars. Today's presenters are Charles Otto and Lisa Berger. Charles is a former FDA, CDC, and National Park Service retail food expert. He evaluates written and electronic retail food safety, asset-based programs, and provides on-site assessments of retail food establishments, commissaries for commercial vessels, and large facilities for providing meals to employees or the public, as well as RTE preparatory facilities. He drafts and updates retail food safety programs using retail food codes and industry best practices as the gold standard. Lisa is a former epidemiologist with the Massachusetts Department of Public Health, with extensive experience in building retail food code compliant HACCP-based food safety programs and investigating foodborne illness outbreaks. She is a subject expert for the National Restaurant Association Solutions, as well as an author, speaker, and expert witness. She has also developed a reopening action plan to help retail food industry establishments execute reopening procedures that ensure a safe environment for both worker and consumer. As a reminder, during the webinar, you may type any questions by typing them into the chat box. And with that, I will turn the presentation first over to Charles.
I would like to recognize the audience today. We've got members from many segments of the food industry online with us today. And you just got a virtual salute from me for the fabulous job that you have been doing, taking care of your customers, who are the rest of us out there that are needing to eat and drink our way through this pandemic. And you've been doing a wonderful job. You had a tough job to do before all of this came, but have been doing a great job. I also would like to recognize the many state and local regulatory agency people that have found time to be with us today, because we're all in this together, trying to figure our way through this fog of COVID-19 to a hopefully shinier tomorrow. And the information that you get from this webinar, we hope will take you there. I have a real affinity for you. That's where I started almost 50 years ago, working in a local health department, and my practice expanded through state and across the nation and over the last 20 years around the world. And out of all of those positions, the hardest was actually working in that local environment, making sure that the food was safe on the streets of America. So you're doing a great job. And on top of all of that, we have added this COVID-19 problem that we're all having to deal with. Again, industry, you have been doing it well for the last little while, and we're getting ready to take your game to the next level, as they say. You've got the agenda before you, and what it is, it's divided into really two parts here. I term this opening part as the 30,000-foot view of the crisis. And it is way up in the stratosphere, and I'll be covering some big things that you have heard of, maybe from a unique perspective, but then the real guidance for most of you that are sitting in the audience today come with this post-pandemic retail food safety, the RAP, the reopening action plan. You'll hear the RAP several times in this broadcast. And that is delivered by our co-presenter from the 20-foot view. In other words, the individual establishment and as they are approaching this. As I said, on this flight, I take you from the 30,000 foot down to about the last 20 feet, and Lisa will deliver the rest of it. But where we end up is really depending on you. This live question and answer is the heart and soul of this. We want this to end up where you want it to, and you do that through submitting your questions in the chat box there. For those of you that are watching the archived broadcast of this webinar, you'll see a email address at the end to submit those questions to, and we're going to keep this live and going. I want to give you a little bit of disclaimer here that I am not a pandemic expert, though I have worked in public health for almost 50 years and have dealt with viral situations almost from my first or second year. I go back to the swine flu days when I was working with the county health department and running a swine flu clinic, and have never gotten away from viruses. But the real experts in this are at CDC and FDA, and would again point to them as your best place for timely advice on that. In this overview, you've heard many confusing terms, and I'll try to clarify a little bit of it for you. The term SARS and CoV-2, that is actually the virus that you see there on the screen. COVID-19 is the illness that results from this virus, and it just gave us a new bad bug to deal with in food safety in a way that we haven't with previous pandemic influenzas there. The origin of this virus was in the animal world, and when it migrated over through an infection to a human and started subsequently spreading human to human, that is when it acquired the name novel, because it was a novel way of transmission there. And you know, as this is on the screen, I want to recognize the human tragedy, all the lives lost and affected by this simple viral particle, something invisible. We can't see it, and it has caused people to die and has created a panic within the world for good reason. The symptoms are very simple, shown here on the left side of the screen. They are the cough, the shortness of breath or difficulty of breathing, fever. An elevated temperature is oftentimes the symptom that people really latched on to begin with, and still use as one of the screening tools. And a severe sore throat, and one of the newest ones, which is not good news for the food industry, is the loss of taste or smell. And the bad news is that most of the spread apparently is coming from people that do not have any of the above, but they have an incubation period that doesn't have any of those problems during the course of the illness, and it does eventually they can get well with it again without symptoms, but other people die from this. It is a pandemic problem, meaning that it has spread around the world, and it wasn't far into this before the World Health Organization declared it as a pandemic. And being a viral person, you know, is one reason that it did attract my attention. Had a long history in the last 20 years of working with the cruise industry, and when the ship showed up in Japan and the spread was throughout, I knew this was not the normal norovirus that we deal with, and it is airborne. And this is one of the most difficult things about it. And being airborne, it is, again, invisible in the air and can come in. And the portals that get it to us are breathing, and also in air that other people have expelled through the talking or coughing and sneezing. And we need to protect ourselves from that. Hand washing is one of the lasting effects, I hope, that will come out of this. We have been preaching in public health for many years: do what your mom said do, wash your hands. And the alcohol-based hand sanitizer can be effective, but not as good as the follow-up with that. We try to isolate people, and that goes back to the earliest days. Is when you're sick, you try to stay home. When you cough or sneeze, do it in a tissue that you throw away and wash your hands. The social distancing is important with that. And this is a strong CDC message at the bottom. The cloth face coverings are not a substitute for social distancing. They, you need both to actually protect yourself. The CDC issues guidance based on the epidemiology, the spread of that. And these are the guiding principles that they have sent out in many avenues for the messaging. But the details will be hashed out by Lisa in the final end of this, and we'll get into those details in a moment. CDC provides the EPI guidance, and in that EPI guidance, they have asked to consider many things in this reopening question. They have many different levels of risk in there. But an article came out yesterday from Harvard University researcher calling the super spreader establishments, i.e. restaurants, bars, hotels, as the next wave of infection. And they're starting to examine this whole thing of spread in our establishments in under an electron microscope type analysis through a model. They proved the model out and looking at pre-closure and early parts of this outbreak, and they'll be looking at it in more detail. It is based on food safety, and this add-on of personal safety, of customer safety has come added on top of the layers and layers of barriers that are in food code. And food code is widely adopted in part of the vernacular wherever you go. But guidance, not enforceable as part of the food code, has come out trying to keep your workers healthy and your customers healthy. And again, Lisa will be getting into those things. But they have divided their guidance up, and I'll have a pointer at the end for that at the end of this. FDA has been involved in issuing this guidance in many times. And from this, I've divided it up, and you can look at many things. And one thing I wanted to point out, I hope you can see this on your screen, where you've got a posted date and an updated, because this guidance is evolving all of the time, and you're going to need to stay in touch with this if you want to stay on top of this problem. At this point, I'm turning the control over to my colleague and very knowledgeable person on that. And so at this point, Lisa will pick up. Lisa, you just have to roll it forward. It's not gonna click. Use your.
Yep. And Lisa, you should have control now.
Here, great. So let me hover over to make sure I can click through here. Okay, great. So I think I was on mute when I started speaking, so I will start over again. Thank you so much, Amy Scanlon, for putting together this webinar. I think it's critically important at this stage in the game when not only is the country beginning to open up all different types of businesses, but we're finally starting to see the light at the end of the tunnel for the restaurants who are able to at least start out very slowly. And people have asked me how this came across. I'm going to give a quick background of how the wrap came about. Mid-March, along with the rest of you, we had the shock of our lives when we had this new disease start to circulate in this country. We suddenly were shutting down businesses right and left. We had the shelter in starting in Seattle, moving its way across the country. And like many of you probably listening, it affected your business tremendously. It affected mine tremendously because 99% of my business is working with the retail food industry. So restaurants, caterers, hotels, stadiums, arenas. And without the consulting, I still wanted to be able to help our clients. We were getting a lot of calls on how do we remain open if we're able to do this safe. So we started consulting on these issues. And the next round of questions coming in from our clients who were operating, providing takeout and delivery was, okay, we have a sick employee. What are we supposed to do? We have an employee who's been exposed to a confirmed case of COVID. What are we supposed to do? How long are they in quarantine? How long are they in isolation? When can they come back to work? And then the next round of questions were, okay, we're starting to think about reopening. How can we do this safely? How can we do this so that we can gain that customer confidence that we are doing it safely, not only to prevent the spread of illness from employee to employee, but ultimately prevent the spread of illness from employee to our customers. So initially it started with answering these questions. We started putting FAQs together, the questions that were coming in. And then I thought, we'll start doing some quick webinars or meetings on some of the recommendations that were coming in from the CDC, the FDA, other organizations. And there was, as all of you know, recommendations were changing regularly just because this was a new illness, and weekly and daily new information was coming in. And it was a wealth of information on the CDC website, which was great, the FDA website, but it was a ton of information. And I was referring our clients to the CDC and the FDA websites and realized they didn't have the time to really read all of the articles, all of the recommendations, the best practices, and define all the relevant information that would apply to their business, to apply to operating safely. So we developed what we call the COVID-19 Reopen Action Plan. So we now affectionately refer to this as the WRAP plan. So I want to go through this very quickly. One of the ways that I felt like it was important to make this a usable, easy program initially it was for our local clients in the New England area, but it needed to be something that was simple in bite-sized pieces. So what we ended up doing is deciding that we need to have an action plan, a WRAP plan with very actionable steps that somebody can take for a safe and a successful reopening. So I'm going to go through these individually, but I'll go through our 7 steps right here. And also just to let you know, the order of these steps were the order in which we felt it was important to follow. So step number 1 was making sure that you had all the supplies that you would need in order to open successfully. And I'll go through some of the details, but as all of you probably remember, early on in the pandemic, the supplies were very, very difficult to acquire. I had a client actually who runs a hotel chain across the world. I'm working on their local hotels, but they had requested that I order something like 150,000 masks. And at the time, I didn't think it would be a big deal. Later, realizing how difficult it was to get supplies, from masks to gloves. We were running out of hand sanitizer, whether it's the gel or the wipes. So I think once people are starting to think, if they haven't already reopened, and there's still quite a few states where people are starting to reopen, that this is one of the first things to consider. A second critical component to a safe and successful reopening is that each establishment developed their own procedures based on the new recommendations. Working with some of our clients, we realized that not two places are not alike. Each establishment, each restaurant has to have their own unique set of procedures because each establishment is very different. But we developed some guidelines on what procedures that needed to be developed. Third, critical component to the wrap is getting the employees trained. And I'll talk about some of the details here, but I have found in starting to get back into my business, we're starting to do inspections. We're doing COVID reopening inspections. We're starting to train people on basics of food safety and COVID, that a lot of the employees in the restaurants, a lot of the information they're getting about COVID-19 is from Facebook or maybe from their friends, and not necessarily correct information. So I felt like it was critical for the manager, the person in charge, to train their staff just what Charles had talked about, and what the symptoms are and how it's transmitted and some of the mitigation procedures. Step number 4 would be to notify anybody who is involved with your establishment. So notifying the health department, any vendors that you might have, any service providers that come into an establishment. Step 5 and 6, these are the 2 biggest components of the wrap. Preparing your kitchen and preparing the front of the house. This is the bulk of the wrap here. This is where most of the work is going to take place, from the social distancing, from the necessary new requirement for not only cleaning but disinfecting all the frequently touched surfaces, to the continual use of masks or face coverings. And then the very last step, to do the self-inspection to assure you're ready. And with this last step, primarily our business is based in New England, but we do have some clients across the country. And I've been reviewing a lot of the various state guidelines for reopening food service establishments. They're all based on CDC and FDA recommendations, but they all do have their own unique requirements or recommendations. And several of them are requiring that establishments do a self-inspection before they're allowed to open. Some jurisdictions are requiring that the inspection is submitted to the local regulatory authority before they open. Others, for example, in Massachusetts, documentation on site so that when they are inspected, that can be viewed by the inspector. So talking about the step number 1, ordering of the supplies, I mentioned making sure that there's enough masks and face coverings. I feel like at this stage in the game, there is now pretty much a steady supply. I have been in, the last few days I've been in the car on a long road trip, and now I'm finding that masks and face coverings are being sold at truck stops and gas stations along the way. So I think we're pretty set there. But making sure you have plenty of hand sanitizer, either the gel, which has to be a minimum of 60% up to 95% alcohol content. Having an EPA approved disinfectant. And what I have on the screen is, it's an app, it's a web app that was put together by the EPA to determine whether or not the product that you're using as a disinfectant is approved against COVID-19. So I want to stress here the disinfectant. What I have found in talking with a lot of my clients and doing some of the consulting is a lot of people are confused about the word disinfectant. I believe up until COVID-19 that people have used the word or term sanitizing and disinfecting interchangeably, but just pointing out that these are not synonymous terms. Disinfecting is very different. So sanitizing, I always try to stress to my clients, this is something you've done in your restaurants all along. Sanitizing is intended to be performed on your food contact surfaces. Specific chemicals have a certain chemical concentration. There's a specific contact time. The intent is to kill 99.999% of the disinfectant was really used in the healthcare industry. So whether it's a hospital, a long-term care facility, or a nursing home. Now the new big thing is in a restaurant, we're cleaning, we're sanitizing, and now we are having to disinfect. This is brand spanking new. So we need to make sure that the chemicals are on this list. I am finding everything from Windex being used as a quote unquote disinfectant, to sanitizers, to all-purpose cleaners. So it really has to be an approved EPA disinfectant. I also have on this list gloves, and I do have some places they don't like to use gloves in the front of the house for their servers, but we have come up with the plan. For example, these very high fine dining establishments, that if they are going to be having their servers use gloves, which we would recommend, they can use a white glove to handle any cleaned and sanitized food contact surfaces, or when they're serving food, and then anytime they're removing soiled tableware utensils, they would use a different color glove, maybe blue or black. I have goggles on here with a question mark, because this is just one of my recommendations. Goggles would not need to be used or purchased, but the intent here is if somebody suddenly became ill at a restaurant, whether it's an employee or a customer, and you had to take care of that person, you would want to make sure that the person handling the ill person is protected. So some type of goggles. Some jurisdictions are requiring that before employees come into work, that they have their temperatures checked. And they do have now all over the web, you can order these non-contact thermometers. This is one of the things that I had a very difficult time finding. I ordered 2 or 3 non-contact thermometers that took about 8 or 9 weeks to get in. And then the very last thing, this is nothing new, cleanup kits for vomiting and diarrhea. This is recommended in the food code, but this is my little reminder for people to make sure that you have these kits available. But also many of the kits do come with goggles. So that's kind of a 2-for-1 if you do have the cleanup kits for vomiting and diarrhea. Step number 2, this is developing procedures on the new recommendations. And a lot of the clients I'm working with, they have been in the industry for 25, 35, even 40 years, and they are very used to the procedures. All the employees are used to the procedures. They have muscle memory. Going back into work post-COVID is going to be a whole new ball game. So they do need to develop procedures. The Massachusetts guidelines that were recently published, these came out on Friday, do require that these procedures are in writing. And I do recommend that because it will help with compliance with all of your employees. But procedures needed to be developed for things such as entering an establishment. This needs to be available for anybody coming into the facility, whether it's an employee, a delivery person, a maintenance person. What are these procedures going to be? Are you going to require temperature checks? Are you going to do a symptom assessment, whether they fill out a form or just review the symptoms with their employee? Or are they going to be required to wash their hands? Or if there's no hand washing sink near the door, are you going to have the hand wipes or gels available? Cleaning, sanitizing, and disinfecting. Again, cleaning and sanitizing, this is something that we have been doing forever in the industry. Most establishments probably already have procedures in writing on their cleaning and sanitizing procedures. Again, what is brand new for the industry is this disinfecting. So what we have done, and it's very small on this slide, so I do apologize, but we put together a poster that's on our website that somebody could print and laminate. And it's very pictorial. It has a picture of a person with a mask spraying the disinfectant on the various frequently touched surfaces. So the doorknobs, the light switches, the chairs, the tables, the refrigerator door handle. But what is also easy about this form is the manager can fill out information such as the type of chemical or the name of the chemical that's being used, the directions for use, so the amount of disinfectant to be diluted with how much water. It will have directions on spraying it. We spray, is it going to be a 6 to 8 inch spraying? Is it going to be a wipe? And then it will have instructions on the contact time. And most disinfectants, as opposed to sanitizers, are going to have a much longer contact time. So it could be anywhere between 2, 5, 6, or even up to 10 minutes in order for it to be effective against this virus. Another procedure that people would need to have in place is what they're with menus. Now, ideally, there should not be any menus available at this point. I do have 2 or 3 clients who they're fine dining establishments. They still want to have their menus available. So they're putting procedures together so that the menus are handled once. They are cleaned and disinfected thoroughly and not used for 24 hours before being given to another customer. Condiments, shared condiments, whether it's bottles, salt and pepper shakers, those need to be completely eliminated, as these are definitely frequently touched surfaces. Again, procedures for frequently touched surfaces. I was recently at a place that was starting to develop their procedures, and they had half a page of their frequently touched surfaces. And a week later, I came back, it was up to 2 pages, then 3 pages. So you will start to identify all the different surfaces that need to be identified. And then social distancing. We're all hearing about the importance of the social distancing in the front of the house and the back of the house, which in the front of the house, it's going to be a little bit easier. The back of the house tends to be a little bit smaller. How are we going to have that 6-foot distancing in between the employees? Are we going to have tape designating the 6-foot space? Are we going to have maybe upside down trash cans placed in between the employees so that they can have the distancing? Are we going to minimize the menus so you don't need as many as employees? Training staff, this is another critical component. So training staff, one, the symptoms and some of the mitigation procedures that Charles had talked about of COVID-19, but also for a lot of people in the restaurant industry, it's been weeks or months since they have been opened. So a refresher on basics of food safety is important. Certifications, it's quite possible that some of the certifications, whether it's the food protection manager certifications in Massachusetts, we require a Massachusetts allergy certificate. Are they expired? Do they need to be renewed? It's also important to review the employee health issues. Again, what are the symptoms? What do they need to report to their supervisor? When can they come to work? When do they need to be isolated? When do they need to be quarantined? And the last part of the training, this was, I was going into an establishment to do a training and realized when I walked in, a lot of people didn't have their masks on properly. We started to do a training on how to put on and take off masks. Some people were putting them on upside down. So it's important to review even some of the basics that we take for granted. Notifying business partners in anticipation of your opening date. Number one here is I have the health departments, and I have been communicating with health departments mostly on the East Coast, but pretty much across the country, and I'm hearing 3 different things. Number one, some health departments are telling people they can open, they don't need to have a reinspection, they don't have to submit a self-inspection report. I have the total opposite end of the spectrum. In certain municipalities, the health department will require an inspection before they can open. And then I've heard other health departments say, we're not doing an inspection, but you do need to send us your self-assessment or self-inspection report. The services and vendors need to be notified. They too have had issues with staffing because of the COVID-19, people being out of work because they're sick, or maybe places even being closed down. Preparing the kitchen. I mentioned that this is probably one of the biggest parts of the wrap. And I'm going to quickly go through this, but being very conscientious in the back of the house, we've got to try to maintain that social distancing. Again, cleaning and disinfecting the frequently touched surfaces, upping the cleaning and sanitizing. Currently, the food code does require that food contact surfaces in continuous use need to be cleaned and sanitized every 4 hours. Now, maybe double that up. But being aware, if a place has been closed down for a while, that if they've unplugged refrigerators, or they have turned off their equipment, or they've turned down their water heaters, that they need to be able to maintain temperatures, equipment is working, hoods have been serviced, water systems have been flushed. When a place is closed down for even 7 or more days, there's a risk of mold growing and other bacteria that could make people ill. And then the front of the house. So this is another big part in protecting not only employees, but customers. So again, distancing, that 6-foot distancing between the tables. In some jurisdictions, the health department will not allow the bar to be used. In others, they are allowed to use their bars as long as the seats are separated by the 6 feet. But eliminating all self-service. So no buffets, no salad bars, no self-service on coffee or beverages. Also electronic pagers. This is, if you think about these buzzers that we use to identify or to notify us when our table is ready, is definitely a frequently touched surface that people tend to ignore or forget. Utensils and table settings should be set after the party has been seated, or if this is for takeout or delivery, they should be wrapped or maybe disposable. Hand sanitizer and wipes should be available at the entry for all guests and the employees. So the last thing I wanted to talk about, I keep mentioning, or I've referenced a couple of times, the wrap and doing a self-assessment or self-inspection. We have developed for all of our clients, which we have made available to restaurants, food service establishments, and health departments across the country. This is the COVID-19 Reopening Action Plan, the WRAP. And I'm going to just go through very quickly 3 slides, and then I'm going to stop so we can open this up to a Q&A session. So what we have on our website, there's 3 parts to the COVID WRAP, to the WRAP. And I'm going to point out, I'm not sure if you can see my cursor moving, but there is in the middle, the COVID-19 Action Plan. And what this is exactly what I just went through in a lot more detail of the 7 steps that we would recommend for a safe and successful reopening. In the action plan, when you click on this green button, every one of the recommendations has what we call a knowledge-based article that has links to the CDC websites, links to FDA, to the EPA. There's audio, there's videos in this section. And then we have the checklist, which is that self-assessment or self-inspection, which in many jurisdictions is required. And this is a web app that is intended to be done on a phone. So I have the screen that I show here is intended to see what this app looks like on your phone. But you'll notice at the very top, if you're able to see this well enough, it says checklist history. So some of our clients are starting to use this app, and they actually are going to have their managers use it on a weekly basis. So this is a history of every inspection that they have conducted for this COVID-19 reinspection. And then there are each one of these accordion menus. There are various questions that address every component in the action plan. And then finally, just to give you a very quick little sample. So when you open up the app on your phone, there'll be a list of different types of questions. And one of the questions, the way that we ask it is just to check off items that have been completed. So for example, was training provided, food safety and COVID-19 mitigation procedures. And each one of these recommended topics, once they have been completed, the person filling out the inspection form will check off that they have been done. Another type of question that I'm circling down here is answered by either identifying yes, this has been done, no, in which the person filling out the inspection report can put in any notes, or an NA. So sometimes some of the items in this checklist are not going to be applicable. The next thing you'll notice, I'm trying to point out, next to each one of these questions in this checklist, there's what we call a tips tool. It's a little blue circle with a question mark, and I have my hand hovering over this to show you an example of when you click on the tip tool, it will bring you to the information. So for example, I clicked on the tip tool next to the employee training, and it has some information about the importance of training. It shows at the very bottom, we provided actually some training when I first presented this wrap to some of my clients, and I presented an agenda that they need to follow when training their employees. They were in panic mode. They didn't feel confident talking about the symptoms or the mitigation procedures. So what we had done is developed about a 20-minute training specific to COVID-19 and the mitigation procedures for restaurants. We have one version in English. We have another version of this video in Spanish. So every one of the knowledge-based articles or questions, you can click on that tip and you'll see a screen very much like this open up. So there's documentation. If people don't have time to read it, they can listen to the audio or to the video. So this is, as much as time as I had, I'm actually 1 minute ahead of schedule here. But I did want to turn this over. I think Charles Otto wanted to mention or acknowledge a few colleagues in preparing this presentation today.
Again, this is Charles. We don't know it all, and we have to rely on the experts that are actually developing the information as we speak. It is evolving, much as this coronavirus has evolved since it was first spotted, not even 6 months ago now. And the information for today's presentation, I'd like to recognize the Centers for Disease Control and Prevention, Food and Drug Administration, and a colleague, Dr. Hal King, with Public Health Innovations. Some of the thoughts were adapted from their materials. The message I wanted to leave you with here at the end is that this information is changing practically daily. And you need to be in touch with your state and local public health authorities to see what the situation is in yours. And as Lisa said, it varies based on the the illnesses that are reported in different communities. They have different standards in place, and you need to stay in touch with that. But you can always rely on going to the CDC website cited here or the FDA and get their latest. Again, it is updated very frequently. So in order to stay in tune with that, you need to be there. I'd like to recognize again EAS Consulting for bringing this webinar to you, and Amy Scanlon for her assistance as our webinar producer on that. And by the way, just to mention, EAS has over 150 independent consultants like Lisa and myself that work in all areas of food safety and other regulatory matters, and we're here to serve you. And I don't know everything, but I know who to call, and that is Alan Saylor. He has I have a client that has a need here or a different need there. He's great for getting a free consultation call together for you and help talk through what EAS can do for you. With that, we'll move on to the questions that have been submitted by the users on this webinar. Amy, could you give those to us, please?
Great, thank you so much. And thank you both for such a great presentation. Our first question, Charles, is directed to you, and that is regarding vomiting, nausea, and if they've been added to the CDC symptom list?
Yes, those are part of the symptoms now, and they was just a few weeks ago when the number of cases as they were rising, they started teasing out exactly what is related to this, and those symptoms have been recently added.
Okay, great. Lisa, next question for you. Can you explain the difference between cleaning and sanitizing?
I'll go through all three. So cleaning, sanitizing, and then we have disinfecting. So cleaning is really getting rid of any visible or tangible debris on any type of surface. It could be a food contact surface or a non-food contact surface, such as a floor or a wall. Sanitizing is when you're trying to kill 99.999% of, I'm just going to say germs here. You're getting rid of most of the germs, and we can use chemicals, we can use heat. Disinfecting, which is the third new thing that is now a requirement in restaurants, even though COVID-19 is not a foodborne illness, we need to be very, very conscientious of this in a restaurant. This is a chemical. First of all, I want to stress it cannot be used on a food contact surface. It is only to be used on a frequently touched surface, and at the proper concentration for the correct contact time, it will kill the virus that causes COVID-19. So the difference is the intention. So a sanitizer is for a food contact surface. It's got a 99.999% kill. It usually takes anywhere between 10 to 60 seconds, whereas the disinfectant is for non-food contact surface. So frequently touched surfaces, it's usually a much higher concentration and a much longer contact time.
Okay, thank you. We do have a question on how can you contact EAS just via the website, not necessarily email. And the answer to that is www.easconsultinggroup.com. So thank you for that question. Our next question is, Daryl, if you'll resend your question. The question is the application available to the industry. I think you mean Lisa's checklist that she's went over. If that is your question. Okay, great. Yeah, so in our thank you email, follow-up email that we'll send out, which will include a copy of this recording, we will also certainly direct you to that checklist. It is a fantastic resource. So additional questions?
Well, while you're waiting on other questions coming in, let me circle back to the answer on cleaning, sanitizing, disinfecting. That absolutely do not skip over the cleaning step, because if the organic material is not removed from a surface, and it could be something like a skin moisturizer on a tabletop where somebody had their hand resting there, that will invalidate the disinfecting power. All of the good chemical that you put on thinking you're doing something can be all for naught, because the disinfectant didn't get through the dirt to kill the virus there. And that's the same for bacteria back in the back of the house too. Clean first.
Great, thank you for that. All right, just another couple minutes. We'll see if anyone else has any other questions. I'll mention next our EAS webinar is on the 4th, and it is actually hosted by Food Safety Strategies magazine. It is on how artificial intelligence and technology can improve food safety. So if you have not registered for that, you can find a link to it through the EAS website, www.easconsultinggroup.com. And from there, you would go to events and then webinars, and you'll see that one on the 4th. So I want to thank everyone. Oops, it looks like we've got one more here. So if I guess Charles or Lisa, this one is for either one of you. If used on food contact surfaces, can it safely be rinsed after contact time? This is a question regarding ammonia and bleach, it looks like.
I'd be happy to answer that. So there may be a situation in which a food contact surface does need to be disinfected. So for example, let's say an employee in the kitchen sneezes and some droplet is on the cutting board or on any equipment there. As Charles said, you need to clean the debris first, and then you need to disinfect it. You want to use that EPA approved disinfectant against COVID-19, and then you want to rinse it, and then you can sanitize after that. But you definitely want to do a thorough rinse of that chemical because it's not intended to be used on a food contact surface.
Okay, thank you. All right, I think we'll wrap it up. Thank you for all the good questions out there. Thank you for joining us today, and Charles and Lisa for a fantastic presentation. Of course, if you need any assistance with your reopening action plan, training, remote training of all employees before opening, audits and things like that, just to ensure that you are fully compliant with all regulations pertaining to your state and federal, please do think of VAS. We'll be glad to provide assistance in those matters. And I want to thank everyone for joining us today. Please join Susan Moyers Thursday for the food technology webinar, and we look forward to see you again in another webinar. Thanks so much.